What drugs are used to handle depression? When talking regarding how to deal with depression, one of the very first things you must recognize is that every drug that is used to deal with clinical depression can have unfavorable side results. With that being stated, this post takes an in-depth appeal at various medications and what types of medicines are made use of to treat depression. Particular serotonin reuptake inhibitors, SSRIs, such as citalopram, Celexa, escitalopram oxalate, Lexapro, fluoxetine, Prozac, fluvoxamine, Luvox, paroxetine HRX, Paxil, and sertraline, Zoloft. In a meta-analysis of 30,000 clients with significant oppressive disorder, 874, 30%, stopped citalopram. Discerning serotonin and norepinephrine inhibitors, SNRIs, such as desvenlafaxine, Cadesla, desvenlafaxine succinate, Pristic, duloxetine, Cymbalta, levomilnacipran, Fetsima, and venlafaxine, Effexor. There is actually yet another variation in serotonin equilibrium between the SNRI and the SNRI. Vortioxetine, Trintellix formerly Brintellix, and vilazodone, Vibrid, are newer medicines that both functions as SSRIs and likewise impact various other serotonin receptors. They are much less risk-free than other medicines because they do not include Norvaldi and they improve your odds of creating serotonin allergy. Other SSRIs, while possibly safe, may trigger issues along with your serotonin harmony. Tetracyclic antidepressants that are noradrenergic and particular serotonergic antidepressants, NACIS, such as Remeron. The significant restriction of this research study was that there was actually no difference in efficiency between sugar pill and diazepam, 0.7 mg, the second most generally utilized blend of both drugs. The primary restriction of this research study was the lack of significant difference in efficiency between the diazepam and diazepine team at a basic 30-time training program. Older tricyclic antidepressants, such as Elavil, imipramine, tofranil, nortriptyline, Pamelor, and Sinequin. These are the ones we advise. The other antidepressant that is authorized by the FDA, citalopram, is known to cause edge effects, i.e. nausea or vomiting, weak spot, mind loss, and is recommended as an accessory in tiny amounts for other evidence. Medications with distinct devices such as bupropion, Wellbutrin. This has been shown for a number of various other medicines. The visibility of a solitary chemical receptor appears to be important in finding out its clinical effectiveness. It is additionally known to function through itself, but at an excessive fee, and might for that reason possess some constraints. To our expertise, the single drug research study and we are the initial team to mention it. Monoamine oxidase inhibitors, MAOIs, such as isocarboxazid, Marplan, phenelzyne, Nardil, selegiline, Emsam, and tranylcypromine, Parnate. Because the impacts of MAOIs appear to be relatively reduced, the FDA has presently released a checklist of MAOIs. This is because the impact of MAOIs is not limited to medications for epilepsy or psychological ailments.